everyone, welcome to ISSA Talk on Corrective Exercise, which I know I get excited about all of our topics, but truthfully, corrective exercise is very near and dear to my heart. So this is part one, and today we're joined by a very special guest, USC physical therapy and biokinesiology teacher and author of ISSA's very own corrective exercise course, Dr. Chad Waterbury. Welcome, Chad.
Hi, Erin. I'm happy to be here.
So Dr. Waterbury received his DPT from USC and his MS from the University of Arizona, which is great. I'm a ASU grad, so I won't hold it against you because I love corrective exercise and what you've brought to ISSA. But here we go. He's an expert in strength and conditioning, physical therapy, and trains athletes of all levels to accomplish amazing levels of pain-free performance. And not only is he the author of some of our textbooks, but he's got numerous other books and hundreds of publications. So the list could go on, but I say, let's get started, Chad, and start talking about corrective exercise.
Sounds great. Let's do it.
All right, so let's start, if you don't mind. Most of us in the fitness industry, we think we know the definition of corrective exercise, but I'm not sure that it's so obvious for everyone. So what is your take on how corrective exercise should be defined?
Well, it's a great question. I look at it as smart exercise can be corrective exercise. It doesn't need to be a completely different category, meaning, no, this is a corrective exercise session and this is a strength training session and this is a hypertrophy session or whatever. It all overlaps. It's like a Venn diagram. The way I define corrective exercise is basically it's an exercise that you're doing to help a joint that has some sort of dysfunction. And I'll give an example here. A lot of people have shoulder issues, shoulder pain with bench press or dips or things like that. And there's something called joint centration, which is just a fancy term to describe that in the case of the shoulder joint, the humerus, which it goes into the scapula, the way it sits there, there's an optimal position for it to sit. And centration basically means it's centered well. Like there's a balance of tension on each side and such. But because of poor programming, poor posture, poor training, lots of different factors, that humerus, so this is the humerus and this is the scapula or the shoulder blade, it cannot sit in an optimal position, which puts a lot of tension maybe on the front of the shoulder, which can maybe pinch some nerves off a little bit, whatever. So a quote corrective exercise, one could be something for the rotator cuff or the external rotators. It could be a face pull or external rotation exercise. And what that does is if the humerus is not sitting in its correct position, then when you have the knowledge to know which muscles to activate, in this case, the external rotators, it helps centrate the joint. Okay, so pull the humerus back in its optimal position. So then when the person does the bench press or the dip or whatever, the shoulder joint is in its optimal position. So a lot of times this person can do a dip or a bench press without pain now. So instead of just going straight to the bench press or straight to the dip, then we do this exercise before, which I would term a corrective exercise to help correct the joint position. So now the person can do the exercise without discomfort and with better performance.
Got it. So a couple things. Number one, as a brief summary, how you're looking at corrective exercise is there is a joint dysfunction or misalignment, and there are activities that you can be doing around that joint to put it in a better position so that it could perform better and reduce the risk of injury. Did I get that right?
100%, because when I designed this course, I was thinking, of course, about personal trainers. And personal trainers are dealing with this stuff all day long. It's like someone comes in and says, hey, I was playing tennis over the weekend and my right shoulder is kind of cranky, but you still want that person to get a great workout. And with what you learn in this course is you learn how to identify what muscles to activate based on where the dysfunction is or the quick movement analysis you do. And then it's like, okay, we're going to add in that exercise before your upper body training today as a way to help you get the most out of your upper body training.
I love that you just brought that up, because one of the things that you said at the beginning was it's not, is this a corrective exercise session or is this a strength session? It's a Venn diagram, and it feels like, and you can tell me if I'm wrong here, that sometimes the fitness industry tends to view it in isolation. Like, we're going to do corrective exercise today, okay? Or, hey, you're a client that could benefit from me knowing corrective exercise, rather than realizing this is a tool that should be in every fitness professional's tool belt. Is that right?
Absolutely. Absolutely. Because everyone encounters this every day. And I'm sure with every client at some point, someone has something that's bothering them, or they don't move as well as they should, or even better, sometimes you as a personal trainer are going to learn assessments, and you're going to be able to avoid any sort of potential injury in the future, because you're going to see that there's weakness or some sort of dysfunction around the joint. And then you can tell your clients like, hey, see how this feels on the left, and see how when you do it on the right, it's different. Okay, that's because of X, Y, or Z. And because of that, we're going to add in these exercises in the beginning of your workout, so we don't have that problem come up in the future. And then you get a lot of buy-in from your client. They're like, wow, he or she really knows what they're talking about. And I never knew that. And I always just thought it was arthritis or whatever. So very, very useful for any strength coach, for any personal trainer, even the weekend warrior who's really into just learning this himself or herself. This is just an invaluable tool. And getting back to what you're saying before, I don't like to make the hard distinction of, no, this is corrective exercise day, or this is a strength day, or, as I said before, hypertrophy or endurance or whatever. It all overlaps. It's like when I got my DPT degree, people who knew me for a long time as a strength conditioning guy or whatever, like, oh, how is it now? Being a physical therapist, is it different now? Like, do you like the old days of doing strength conditioning? I'm like, no, I'm doing what I was doing before. It's just I have more tools in the toolbox now. So with my DPT degree, I know now if someone comes in with right shoulder pain, for instance, I just have more tools to work with. And that's what I want to do with this course, is I wanted to give personal trainers, strength coaches, just more tools to work with and quicker ways to help your client move better, perform better, overcome some sort of discomfort or whatever.
It's great that you have that passion for the personal trainer and the strength coaches, because it really empowers them to deal with things that maybe 10 or 15 years ago or whenever, they didn't understand how the body totally moves. So it sheds total light on how we should be functioning, and that pain isn't necessarily the norm, and that there are things that a fitness professional can do to help alleviate some of those situations, right?
Oh, that's so true. And I will say that the more tools you have in your toolbox, the more enjoyable this is, because you can help a broader range of people. And it's just good to know that, oh my gosh, I was doing whatever method for years because this person has whatever stiff hamstrings or whatever. And now I realize why that wasn't working. Now I can do this instead. And it has this added benefit of strengthening. And the client doesn't have to spend so much time stretching or doing this other stuff that was ineffective, they didn't want to do anyway. So it's just, you can work with so many more people, and your knowledge base just grows and grows and grows. I will say that with each passing year that I work with people, it becomes more enjoyable, just because I know more now. I know what things to look for. I can see, oh, if I see this, and this is probably the problem, and here's the corrective exercise that will really help this person move better, feel better, or perform better in the gym.
While I don't know as much as you do, Chad, I do know this. I love what it does for the fitness industry, and this topic is what made me really fall in love with the fitness industry. So I think we all know I love corrective exercise. You love it. Let me ask you a couple questions before we start wrapping up. One is, do you think there's any myths or misconceptions out there about either what corrective exercise does or who it's for? Anything that you want to provide your take on?
It's usually just an issue of semantics. People want to they don't really know sometimes what corrective exercise means, or they're like, there shouldn't even be that, it should just be smart training and all that. And that's just an issue of semantics. I don't, it's not really worth arguing about or whatever. I just look at it as, I don't look at it as, is corrective exercise good? That's when people understand this course and the type of material I give, it really can only be good, because I'm just helping people understand in a more in-depth way how the joints work, how the body moves, how to build strength, how to build coordination. That's stuff we all need. We just, have to label it something so we can differentiate between, endurance work or strength work or whatever. But I just look at it as, whether you are an endurance person or a strength person or whatever, these are exercises that you will probably need at some point, even if you don't even realize it. So it just becomes smarter programming. It just becomes better exercise. So if you think of your world, your program that you're on, these are just more tools, more exercises that can improve your strength or improve your joint health or whatever. And that's what we all want, as opposed to just, giving semantics, so much play in this.
Wouldn't it be cool if corrective exercise was required for a personal trainer to start training?
I would do everything possible. I would be the first person to sign that petition. I mean,
I'm not petitioning for it. I'm just, as we were talking, I was thinking, gosh, this should be a part of every personal trainer, their portfolio of what they've gone through. So certainly not trying to position that, but it is good for all trainers. Chad, in all the clients that you've seen, all the athletes that you've worked with, what would you say, and we won't hold you to it, of course, but what would you say is one of the biggest drivers of problems with our clients, like the joint or maybe an imbalance that you come across time and time again? Everyone has the same issue.
Mm-hmm. I would say the one I see most frequently is weakness of the glutes in the frontal and transverse planes. And for people who haven't taken the course, they might not know what those mean, but I'll give you a simple explanation of what it means. At the hip joint, the glutes perform 3 different functions. One is they pull the leg back when you're sprinting. It's called hip extension. The other is they pull the leg out to the side. That's called hip abduction. So if you were just, to pull your leg out to the side, or if you're in a side plank position, you try to lift your top leg up, that's hip abduction. I see weakness in that all the time. The other area I see weakness is in the transverse plane. So the third function the glutes can do at the hip is to rotate the knee out. So pull the knee outward. It's just not pulling the leg out, it's turning it outward, okay? Like a fire hydrant drill. That's actually external rotation of the hip. So I see weakness in hip abduction and hip external rotation all the time. And I'll say to someone, oh, your glutes are too weak. And that person might say, yeah, but no, that can't be. I do lunges, I do squats, I do deadlifts, I do all this stuff. I say, that's fine, but that's only primarily strengthening one of the 3 functions of the glutes at the hip. I would say, okay, are you doing certain banded exercise, like a standing fire hydrant or something like that? And they're like, I don't even know what that is. And it's like, oh, well, that's the reason. So when we develop strength for those 2 movement patterns that are neglected in most training programs, which is hip abduction, pulling the leg out to the side, or hip external rotation, which is turning the leg out, and you use these really cool band exercises and they get really strong in it, their hips feel so much better. Their hamstrings have so much more mobility without doing any stretching or anything like that. Because when those muscle fibers are weak, it can lead to knee pain, it can lead to pelvic issues, it can lead to low back stuff, it can lead to hamstring stiffness, all these things that are so common and prevalent out there in the gyms today. So that's one of the main things that I see on a daily basis. And I talk a lot about this and how to identify and correct it in the course.
I, of course, am very familiar with your course. And then on a side note, without me even knowing that that's how you were going to respond, I was on a conference call the other day, and one of the women on there was talking about how she had just met with her running coach. And we were like, well, why are you meeting with a running coach? What's going on? And she's like, oh, well, apparently I sprained my ankle about 10 or 15 years ago, and that's altered how I run. And now I'm having knee issues. And all I could think, but not say, is, I wonder if you ever took care of that glute medius weakness that might have resulted in the ankle sprain, which might be causing more knee pain. And I feel like through your explanation of the frontal plane movement and a lack of stability in the hip, that maybe that is an issue, and so maybe we should follow up with her. But
yeah, that's a great point. And I want to mention one thing about what you said. And I talk about this in the course. If you have a problem at a joint, in this case, your example was she had knee pain, correct?
Yeah.
Most often there's a problem, a dysfunction in the joint above or below it. So if someone comes to me, or like the quick elevator answer, someone says meet someone on the elevator and they're like, what do you do? I have a physical therapist. Like, oh, I have right knee pain. What do you think the cause is? My brain immediately goes to the ankle and the hip. It's probably a dysfunction at one or both of those. So that's why it's so important to be able to identify this and know good assessments to see, like this woman you're talking about, there might have been a long period of time where she didn't have any knee pain. And even though she didn't correct her, she didn't go through the right physical therapy or whatever for her injury, a good corrective exercise person or someone certified in this could see that, oh, there's a problem in this right ankle. And she might say, well, yeah, but there's no pain. I don't have pain anywhere else. It's like, oh no, the ankle affects the knee. So if we don't correct this, you might have knee problems. And sure enough, she did.
Yes, it's like fortune telling at its finest, right? And you said something very key that I hope our listeners caught, which is when there is problem at a certain joint, the issue is probably above and or below it. So I want our viewers to take that with them, because we're going to have part 2 coming up where we talk to you a little bit more about finding out what those issues are and how we fix them. But I want to give our viewers a break, but thank you so much for joining us, Chad. I really appreciate it. Check out his course. It's amazing. It'll change how you treat clients, and it'll bring a whole new value that you can serve others with.
Thanks so much, Aaron. It's my pleasure.